Dr. Sursik, it's great to have you with us, and it's a pleasure to be able to talk to you a little bit about an interesting topic. So we've seen how treatment has evolved from historically what has been typically traditional mainstay treatment of surgery, chemotherapy, but also radiotherapy at times as well too, to an era of precision oncology or precision medicine. Now we're starting to look at the surface of cancer cells, different proteins, different biomarkers that are expressed in them. Tell us a little bit about what this is meaning for oncology treatment, and how you think of precision medicine in oncology.
Thank you so much for having me. So precision medicine has really advanced oncology and oncologic care, and it's a really exciting era because basically what we're able to do, or what we're looking at now, are specific individuals' cancer signatures.
You treat solid tumors. More specifically, you treat patients with certain gastrointestinal cancers. How have you seen precision medicine translate into this context of clinical setting and practice and what you do on a day-to-day?
Precision medicine has changed a lot for us in colorectal cancer. So initially with cytotoxic chemotherapies, when people had advanced disease, they lived about a year or so. We were able to make some progress. Now we can really look at an individual's tumor, and there are certain biomarkers that we can identify that we have therapeutics for. And I think the exciting thing for us is, for one, now that we have identified many of them, to make sure that we're testing for them so that we can offer these therapies to patients that have these biomarkers. But then the future is to identify more and just keep kind of chipping away at the pie, sort of is how I think about it.
So how have you seen at least these targeted therapies, and then of course these biomarkers, help best inform your treatment strategy, but also thinking about just how it's been optimized more specifically to help improve patient outcomes?
I mean, it's been incredibly important in my practice, and I really want to know the genetic landscape of the tumor as soon as possible, as early as possible. And so whether that's, right at the time of diagnosis, even if maybe the first therapy may not be affected, at least we know so we can kind of outline the next plan.
With all of that progress that's been made, what are some of the gaps that you're currently seeing, observing in the context of the precision medicine paradigm?
I think that the biggest gap or challenge for us, certainly in colorectal cancer, if not throughout all of solid tumor oncology, is enabling or empowering our own immune system to be able to fight the cancer.
The question here is oftentimes, how do we make sure that certainly the broader community of patients, of physicians, have access to a lot of these new advanced testing capabilities to be able to then kind of treat patients with the right medicine at the right time point and hopefully have the best outcomes for patients?
I think that's so critically important, that these advances don't stay just in large academic centers, but that we're able to disseminate that to the community really worldwide. And the tests are available. This is supposed to be for anyone and everyone with these mutations, and that's our goal. I think really this is the only way, is by all of us working together as opposed to in parallel, that we're really going to make the progress that we need.
Before we conclude, I just wanted to say thank you on behalf of all the patients that you take care of. We greatly appreciate everything that you do, and it's been a pleasure to have the opportunity to speak with you today.
Thank you so much. I appreciate that. Thank you.